So primarily they are focusing on more towards the bio-innovation applications. So in fact life science based innovation applications. So like that we have two technology business incubation facility. So before I go in detail, I would like the participants to introduce yourself so that it will be clear for me what exactly that I have to talk about. Can you please introduce yourself?
I'm Archana, I'm the field coordinator of EDAA, Mother Teresa University, Kolkata.
Okay.
Hi ma'am, good morning. I'm Gunasundari, EDC coordinator, Ambedkar College, Mathura. I'm Dr. Anita from Ambedkar College, Mathura. Dr. Kalachelvi, Vatnad College, Mathura.
Okay.
I'm Vasudeva, field coordinator, Central Polytechnic College, Chennai.
Global Party, Global Party, Global
Kumar, ED Hub, Field Coordinator, 100 Global Party,
Virudhunagar.
Srinivasan from Tamil University. Dr. Balasubramanian from Tamil University.
Dr. A. Senthil Kumar, Tamil University, Tanjavur. Dr. Suvedran, ED Field Coordinator, MS University, Tirunelveli.
Vinod Kumar, St. Joseph College, ED Coordinator.
Vignesh,
Trichy, yes.
Tanjavur.
Tanjore.
Vignesh Field Coordinator, IEDP Hub, Annamalai University, Chidambaram.
Shanmugam Marippuram, Government Polytechnic College, Field Coordinator, Thuthukudi.
This is Assistant Placement Officer.
So thank you, sir. Again, I would like to welcome you all for this morning session. So on behalf of this innovation ecosystem, what exactly the Shastra University have, so I personally invite you all. So I hope you have a different sessions. So first session is mine, and second session is again Anantaraman sir is going to talk about all the opportunities, what exactly we have at Shastra University. And I think followed by the afternoon post-lunch session will be your visit to all the infrastructure.
They are not interested.
Okay.
Just introduce yourself.
Yeah.
Good morning ma'am, I'm Dr. Sureka from Holy Cross College, Trichy. I'm Dr. Pudika from Holy Cross College.
So today I am going to talk about this innovation opportunities, especially in life science. So I believe this is one important session which is really required. Many of the people who really do not know what kind of innovations would be possible in the life science. So one good example that we all have gone through this pandemic and the other things, like a lot of innovations actually happened in the healthcare and the other aspect. In fact, vaccine discovery is one of the major breakthrough with which only now we are all able to move towards the physical mode, doing all regular activities. That is primarily because of the strength what we have at our country, especially in terms of life science sector. So here, since you are all primarily from faculty and the EDA set, I don't want to talk about much on the innovation and entrepreneurship, which you all have aware. But coming to the life science sector, there are few important aspects that I would like to talk about. So innovation, as we all know that this is actually a word which is coined from the Latin word, which is the meaning is renew. We have to restructure, we have to renew something. It may be a process, product, technology, service, anything that we can renew it. So this, why it is called as renew, if something already existing, we are trying to improvise any of the characteristics. That is what still we are practicing this innovation always. This is primarily the actual meaning is renewal only. So it's renewing any of the technology that we are practicing, want to improvise their characteristics. So when we talk about this innovation, I always believe that 4 different mantras that we want to keep in. Before I talk about that, I would like to tell you one story that we have gone through in our lab, because I've taken this CEO charge only last April 2021. So before that I had an experience in the lab as a researcher. I have more than 15 to 16 years experience in the lab. So we usually used to have interactions with the students and the other BTech and Tech students, and I do have research scholars, PhD students. We usually have an interactions with them. So so usually we had practice at Shastra, like we have given the laboratory access to the undergraduate students also. So under my supervision, there are some undergraduate students who are also working. We all have known, like undergraduate students, they don't listen all, they don't know all concepts. They just, like walk in the lab, Jalia, they used to do some of the experiments like that. So we always, like believe our PhD student to take care of this undergraduate students. So we usually tell them, these are all the experiments, this is the design of experiment. When the students, undergraduate students who are working, like you will also be associated with them, so that there won't be any mistake happen. So that was, after 7 o'clock, like evening, I was not there in the lab. So there are two solutions that they have to mix it. So there is a solution A and solution B, both together needs to be mixed. So what has happened, this PhD scholar informed the BTech student, hey, you just mix these two solution in such a way that all she informed, and she went to take some other things in seams. He was restless, like always BTech students are jolly, he have to wind it up. So what he did, instead of mixing A to B, he mixed B to A. He mixed differently, but that we never realized that nobody will do it, like we all have to do it very typical way. We don't want to handle something a different way. So that is what, like this innovation requires a kind of a creativity and more willingness in terms of taking risk of implementing any kind of a project. It is not unless you are, unlike your regular typical projects. What this boy did, like this, instead of mixing A to B, he mixed B to A, and suddenly the PhD student have seen that something different happened in the reaction. So next day I came, she brought all the results, and she was saying that this idiot was doing mistakenly that he mixed B to A. But like that was one of the origin of innovation that happened in our lab, which we never realized that we can do it B to A. Because that student didn't know what is A, what is B. But we know what is A, what is B. So why this kind of reactions happen, that we know when suddenly B mixed to A, because A always we used to mix it with B, we know what is the reaction that usually happens. But we never did this B to A, but this guy did, have got a different reactions that we came to know why this has happened, because we know what is B, what is A. So that made us to realize, yeah, you can do this way, and we started working on a different way. Like usually we used to work on one path, and suddenly this boy who did mistake made us to realize that we need to restructure the entire experiment. We moved into a different path. Unknowingly, this boy are the one who gave this kind of an opportunity to understand, because that one we wanted, in fact, a hollow tubular construct. I am basically a tissue engineering person. We are engineering a different living tissues in the lab in order to meet the organ demand. We all know that there is no organ to recipient rate, like this always mismatch. So to avoid that, our lab is primarily last 15 years we are working on developing different tissues that must be functional in the lab. So that would be a one good advantage for the human who wanted this kind of an organ or a tissue. So that would it actually improves the quality of the patient care. But I believe it's not something which is immediately is going to happen. Takes a lot of research, lot of things. That is a one important problem in the life science, right? So I have something in my mind. I cannot do it immediately. I cannot bring it to the market immediately. Need lot of patience, lot of research work. For example, Zomato that we all have known. Like nobody have realized this is success agunu. We all knew that everybody used to go to restaurant for venting out. Like ஏதோ ஒரு ஃபங்க்ஷன் எல்லா ஃபேமிலியோட சேர்ந்து போவோம், இல்லை ஃப்ரெண்ட்ஸோட சேர்ந்து போவோம். ஸோ ரெஸ்டாரண்ட் போகிறதே வந்து ஒரு முக்கியமான விஷயம். பட் இஃப் somebody who had an idea, I am ready to deliver the food to your place அப்படிங்கும் போது அது வரைக்கும் நம்ம யாருக்குமே தெரியாது நம்ம ஃபுட்டுக்காக தான் ரெஸ்டாரண்ட் போகிறோம். we all have thought like அது ஒரு வெண்டிங் ஏரியா, நம்மளுக்கு ஏதோ ஜாலியாக எல்லாரோடையும் போய் சாப்பிடுறது. இப்போ என்ன பண்ணுறோம், நம்ம எங்கேயுமே போகிறதில்ல. we are bringing food and everybody are doing that, which we never realized that this is going to be a very successful market that they are achieving, which is something very out of the box thinking, right? So like the way that we have lot of innovations, lot of things that we never realized that this may have a very excellent breakthrough. But this Zomato also have definitely have done lot of homework before they start this. இது ஒன்றும் ஈஸி கிடையாது. And always we have lot of, I always tell all to my students that like this innovation can be possible only when you have some when you go through some kind of a pains. இப்போ எனக்கு ஏதாவது ஒரு important pain இருந்தால் மட்டும்தான் I'll be always thinking about that I need something to do it. Let's say for example, this is an innovation that I told, which is actually the experiment that we made it and we have demonstrated to Government of India, where it is possible for us to create a living blood vessels in the lab within 5 minutes by incorporating the cells at a different domain, which no one have ever done in 5 minutes. This we demonstrated with the process that we developed after the discovery of that student who made mistake. We did lot of experiments and we have come across the process which has the capacity to develop these blood vessels in the lab in 5 minutes. I was recognized for that particular innovation from the Government of India, and I am the recipient of Innovative Young Biotechnologist for the year of 2016. So why I am saying this is something which is a very unique creativity that we need to take it, and it is something very challenge, right? Like nobody, if I say something, anybody, நான் வந்து ஒரு blood vessels so living blood vessels நான் 5 நிமிஷத்துல பண்றேன் அப்படின்னா anybody will believe, and everybody knew that it is not something very easy task, right? So always innovation demands creativity and willingness to take something very difficult, challenging program. It's not something a usual typical projects that we are handling. So I believe you are all the facilitators of innovation and entrepreneurs like us. So please inculcate this particular information to all the student communities, because they are not aware. Like நிறைய நேரம் நம்ம teachers என்ன பண்றோம்னா இதை செய்யாத we are telling too many things. The first important quality என்ன தெரியுமா? Break the rules. Don't follow the rules. See, I told to my student that you should mix only A to B, but this fellow never realized, never listened to me. That made us to innovate something in new process, and that has a very good value too. Similarly, our lab used to do a lot of work like this. We actually wanted to develop a 3D printer. That time we don't have any 3D printer at Shastra University. That was something a very hype word that everybody started talking about 3D printing. So immediately our lab students wanted to develop 3D printer at our lab, because it's not the regular 3D printer that we wanted. We wanted something, a printer which has to print the cells, because we are basically a tissue engineering people. We wanted to print cells. We don't want to print any materials. They have a lot of printed objects here, but we don't want to do it. So I was a mentor of the student. So அவன் வந்து கிளாஸ்க்கு ஒழுங்காக வரவே மாட்டான், எப்பயாவது தான் வருவான். So I knew him because I used to take classes from last 2-3 years for him. So I know him how good he was in academics. நிறைய கிளாஸும் பங்க் அடிப்பான். பட் நான் ஐ எம் ஆல்சோ a mentor. So mentorனா here என்ன பண்ணுவான்னா, they have to come and meet me even if I am not taking class. We used to have a chat, not technical chat. சும்மா ஜாலியாக ஏதாவது issues இருந்தால் we used to solve it. So that way that I asked Enada, you didn't come to a class. Then he said, ma'am, I was very busy, like I have a lot of work to do. Then I was surprised to know that in the class. Then he said, No, madam, I am working on more IoT projects. Like this is a one which I heard from some medical nanotechnology student. No, we never realized, like it was not connected to his path. He is a biotechnology student who is working on some IoT aspects. He is saying that, like நான் என்னோட வீட்டில் இருக்கிற டிவி ஃபேனு இது எல்லாம் என் ஃபோனில் தான் பண்ணுவேன். Then I was surprised. சும்மா போய் சொல்லாது. Then next day that boy brought everything to me and he demonstrated. Then I had curiosity. I wanted to use his expertise in developing useful products. Then I said, see, we wanted to develop a 3D printer. Will you be able to give all the connections? Because we can build hardware. But we wanted some kind of a automated, because 3D printing oda mukkiyamaana vishayame pathina automated irukum. So it's completely computerized. So will you be able to give this integration of the IoT to the printer that we are planning to develop? He said yes. Then he brought some mechatronics students. He brought everybody. Then what we did, like I told them that don't ask any money. We don't have anything at present we have. So let us first prepare a proof of concept or some small prototype. That would be essential to showcase to somebody. If I say something that I have very excellent idea, I'll be able to create a 3D printer nu sonna ellarum silichittu poiduva. Basically at that moment we don't have any 3D printer at Shastra, and obviously we don't have any expertise in that particular area. So I told them that okay, இங்கே கார்பெண்டர் இருக்குது, இங்கே மரம்லாம் நிறையா பண்ணுவோம். ஸோ ஐ செட் வாட் எவர் த வேஸ்ட் திங்ஸ் ஆர் தேர், இந்த கார்பெண்டர் கொஞ்சம் கொடுத்து we will create some dimensions. We created some hardware things and we want to integrate everything together. And this fellow was doing all in the Android app and everything. And we are trying to integrate everything simulated to some extent, and through which we are trying to create a prototype. That prototype have the capacity to move in all 3 directions. Actually 3D printer or a concept is only the printer which can move at all 3 directions, X, Y, Z. That is a concept. That's all that we did. Then immediately we would like to showcase this prototype to the management. So even the Pugarendi sir is a dean mechanical. So we wanted to get his appointment. So he gave appointment. So we all took all the equipments, whatever that we prepared, and we went there and we showcased to them and we demonstrated. And Pugarendi sir invited many of the mechatronics and mechanical faculty from their department, and they all listened and finally they all laughed. For the reason that எதெல்லாம் பயல பண்ணாத சொன்னேனோ அது அத்தனையும் இதில் பண்ணியிருக்காங்க. So like that finally brought into a very excellent product. So always tell your students that if something that they read, see all the concepts that we read for one particular applications, one particular property, but now like when you change it, let them learn what would happen, because that can give lot of like ideas for the students to move forward. So I always believe that, because I had personally experience on breaking the rules of innovating many things, so that is very important. The next important collect the ideas every day. So ask them to collect the ideas. Enga ponalum they have to think about that, because why suddenly when my PhD student who was there when the person mixed B to A, she was not able to understand the process and she didn't know why this has happened. But for me it was not the case. Even I was not there during that time. Next day when they showcased everything, I may be able to correlate to what has happened, in what way that this can be taken for as beautiful applications. For the reason that I was always thinking about one particular problem for which what is the solution, because we wanted to develop this kind of a blood vessels. That was one of the thing that I had in my mind, for the reason that a grandma who was 86 years old had a problem in the, you all know now, a lot of bypass surgeries where they have to take the cephalus vein. That itself is the biggest problem, like the 86 வயசுக்காரவங்களுக்கு vein அங்கேருந்து எடுத்து அங்கே ஒரு சர்ஜரி, அதுக்கப்புறம் அதை இங்கே bypass யூஸ் பண்ணுவாங்க. Vein cannot be the right substitute for the arteries. that we all have known from the school days itself. Arteries la higher arterial pressure irukum, veins vandu low arterial pressure irukum. Low pressure தாங்கக்கூடிய ஒரு ஐட்டத்தை தூக்கின்னு வந்து ஹை ப்ரெஷரில் கொண்டு போய் we are keeping it. So okay, இப்போ எங்கள் பாட்டி வந்து 86 years, that graft is going to be there for another 10 years. Okay, 96 வயசுக்கு மேலே பாட்டி இருக்க போகிறது இல்லை, fine, that is fine. But somebody who had the same problem at 40 years, think about what will happen to them. So there are a lot of problems that people are suffering because of the absence of this kind of a graft. So that made us to think that why don't we see, we are working in this particular tissue engineering la romba nala adha panna idha panna, but this is one of the important problem why we don't take it. So for which we started working on for the past 3 years. For getting a solution, we wanted 3D printer because we came to know that 3D printer would have the capacity to create a hollow channels. Tube mari oru koda mari enak venum, ana adu vandu flexible ah irukanum, biocompatible ah irukanum, blood allow pananum, hemocompatible ah irukanum. Lot of problems are there for me to bring it that. அப்போ ஓட்டையா எனக்கு ஒரு ஹாலோவா ஐ நீட் சம்திங்னா என்ன பண்ணணும்னா ஸ்டாக் பண்ணுறதுக்கு 3D printing is the only option which we came to know that through literatures. ரவுண்டு போட்டுட்டு அப்படியே சேனலை எடுத்துன்னு போயிட்டீங்கன்னா then that will be possible for us to do it. That made us to think about this 3D printing concept, and we worked with the student. One student said that we are working. But my objective is not to build 3D printer. In fact, we want to build actually the hollow channels. That is the reason that the student who did accidentally made me to think, okay, idu full close aayidhu madam. Then I said, this is a reaction differently happen. You just keep it, do the same mistake again with a lesser time. You'll be able to see this. Tell me if you see this. Then suddenly she did and she took, yes madam, it is coming. And I said, see, you should understand why B is doing this. So that made, now 3D printer develop பண்ணுறதுக்கு நாங்கள் கிட்டத்தட்ட ஒரு 6-7 மாதம் உட்காந்துருந்தோம். கடைசியில் இந்த பையன் வந்து ஒரு நிமிஷத்தில் given an idea that made us to create the structures within 5 minutes, which in fact do not require any printing facility. Factfully, இப்போ நான் ஒரு டாக்டருக்கு சஜஸ்ட் பண்ணும்போது நீங்கள் ஒரு பிரிண்டர் வச்சுக்கோ, இதை பண்ணால் அதை பண்ணுன்னா nobody will do it. இப்போ our suggestion is that if it comes to the market, you can just use this solution and the cells of the patient, mix it, create the structures in the theater, keep it, that's all. You don't want anything, which is simple, which do not require more manpower, more laborious things, right? So that way, that the technology innovation is very important. So while saying this, we should always focus on our ideas. So you have to collect the ideas everywhere. Inga vena enna vena kadaikum. Doesn't mean that இப்படியே தான் போகணும் இல்லை, எப்படி வேணால் போகலாம். So you should not, the student should not set any specific aligned path. Ask them to do a random path. Create a solution. So that is very important. Then another important aspect, like believe in the impossible. As I said in the first, like if I say something, I can prepare a blood vessels, which is living blood vessels, in a matter of 5 minutes. It is not possible, right? But when I believe that is possible, it automatically our mindset is in a way that to move towards of searching an idea, searching a solution, searching a different way to like improve my creativity in terms of inculcating the ideas wherever I am getting. I just want to fix it and see whether will it work or not. So the student must definitely like யாருமே பண்ணலன்னா நம்மளால பண்ண முடியாது doesn't mean that. Maybe it is totally a presence of mind how people are applying. There are few people who are there for more than 20 years cannot achieve something which can be achieved by even a student who have more passionate towards of breaking all the rules and finding an idea with the good presence of mind, good creativity. It is possible. So it doesn't mean that இது வரைக்கும் ஒன்று வரவே இல்லைன்னா வரவே கூடாது இல்லை. It definitely will come, because when I was doing PhD, we used to ask our guide, சார் எங்களுக்கு ஃபோனில் இன்டர்நெட்டில் அப்போல்லாம் பார்க்க முடியாது, ஸோ we wanted a PC. அப்பையும் 24/7 வைஃபை கிடையாது. We have to go for the broadband. இதெல்லாம் எங்களுக்கு லேபில் பண்ணி கொடுங்க. ஸோ இப்போ it was not like that. நான் லைக் இப்போ வரப்போகிற பீட்டுக்கு பையனே ஏதாவது ஒன்று சொன்னோன்னா அவசரமாக இப்போ என்னன்னா ஏதாவது கிளாஸோ இல்லை ஒரு எக்ஸாமோ வச்சோன்னா அடுத்த செகண்ட் அவன் அங்கேயே ஆன்சரே பார்த்து சொல்லிடுவான். Right? So it's more accessible, right? Which we never realized when we were in the school days, we were in the things. Because when I was doing my BSc, MSc projectலாம் பண்ணும்போது லைப்ரரியில் போனால் கூட அந்த பேப்பர்லாம் இருக்காது, அந்த ஜேர்னல்லாம் இருக்காது. இப்போல்லாம் அப்படிலாம் இல்லை, எங்கே வேணால் யார் வேணால் நின்றுட்டு just pay money so that it is accessible to anything which you want. Everything will be delivered to your place, right? So this is something impossible that we thought, now it is very much possible with the available infrastructure. So nothing is impossible, everything is possible, which is always you should inculcate this into every student that it must be possible, all impossible is possible. And most important thing for the innovation, because innovation, I believe it is more than creativity, because you have some idea, you have to apply your creativity and for that particular idea and you have to make it as a solution. So it's more an application, not only learning or understanding, conceptual learning. More than that, we have to imagine something and we have to apply this for some specific problem to get it done, right? So when you do this, I believe it is the higher level of this creativity, higher level of the innovation can brought into entrepreneurship. Everywhere we see all the business, some or other way that there will be some kind of innovation. It may not be necessarily from product or technology or a process. Even sometimes the innovation comes from the service, comes from the business model. Anywhere it comes, like this innovation. Ella business la engiyo or edathila or innovation irukku, because innovation is very important for all kind of entrepreneurial activity to what I can say, you can like, because all business have many competitions. If at all you wanted to sustain in the market, innovation is the only solution through which you will be compete with the other existing partners and you may be able to sustainable person in the market for a longer period of time. Still, like after 100 years, we don't have any other option for insulin. இப்போயும் நம்ம அந்த காலத்துலேருந்து இந்த காலம் வரைக்கும் இப்போயும் இன்சுலின் தான் ஒன்லி சொல்யூஷன். இன்சுலின் டிஸ்கவரி ஸ்டில் தட் இஸ் another important advantage in life science. லைஃப் சயின்ஸில் பார்த்தா the gestation time is very high. அதனால என்னன்னா ஈஸியாக nobody can crack it. Even if somebody has seen also, it's not so easy for them to compete with you. So it may take some time, but sustainable solution na always you have lot of opportunities in life science innovation. So you have to build a team for, because ஒரே ஒரு ஆளால ஏதாவது பண்ண முடியுமா கேட்டா you cannot. When I talk lot of examples, when I was doing research, I told you I was not doing anything. I was just assisting and I had packed with the amount of students and which has lot of different capacities. In my team I have mechatronics student, mechanical student, biotech student, computer science students, ella, without which it is not possible for us to deliver something. So you please make the students to work more on multidisciplinary or interdisciplinary research. So the team must be built with a diversified area. இப்போ அவன் என்ன பண்ணுறான்னா ஒரே தனக்கு தெரிஞ்ச ஒரு 4 பேரோடையே சுற்றி இருப்பா, அவள் கிளாஸில் 4 பேர் சேர்ந்து ப்ராஜெக்ட் பண்ணுறதோட you can even facilitate the students to think about bringing a different area of expertise, ask them to build one strong team, ask them to work for a specific problem. Then that will definitely give a different solution. ஏன்னா மெக்கட்ரானிக்ஸ் பையன் திங்க் பண்ணுறதுக்கும் ஒரு பயோடெக் பையன் திங்க் பண்ணுறதுக்கும் lot of differences. So when all together have a brainstorming discussion, that will definitely give you a very excellent solution. So I always believe these are the 4 different mantras if anybody wanted to crack anything, including life science. Why I am saying life science na ella bayindu odi poiduvaanga. It was something a very difficult task to achieve, takes lot of time, lot of regulatory approvals, but doesn't mean that you cannot. In fact, if you give more time on this, and definitely once you mature, it's not so easy for others to compete. So that way sustainable solution always would be possible in life science. So coming to the innovations, like as I said, there are a lot of innovations, product, process, service, business, everywhere that we can have different innovations. And also people have differentiated into an incremental innovation and the disruptive innovation. Incremental innovation, if something already existing, you are trying to add more value to that existing part, that is incremental. Adoda impact on the consumer. Disruptive innovation. This is what I said, like Zomato. It's not anyway, it's comparable for a life science innovation. But again, like it is something disruptive technology that no one ever thinks. Similarly, Redbus, I had an opportunity to listen to his talk, CEO, co-founder, who said, like he was working in some MNC company and he wanted to celebrate Deepavali with their family members. He wanted to go. That time, like he was trying to get the tickets. He was not able to get the tickets. At that time, he was not able to even celebrate this Deepavali with their family members. He can't go. That made him to realize, he did a lot of homework in fact, but this Redbus concept easy will be able to go. I always think, like only one person who thinks differently want to give solution for the problem that they are facing. Others and all, we used to face the problem and we don't want to go to that problem, we will move away from that problem. We don't want to find a solution for the problem. So ask your students to find more problems, what they are facing. They ask them to list out these problems and give these problems to the students. Same again, will you be able to provide a solution for this? There are a lot of opportunities still we have. We need a lot of things to do it. And coming to the life science, like there are a lot of areas. COVID is again, there are a lot of varieties again, Omicron, lot of other sequences. There is a difference which have a different kind of properties, different kind of infections. Similarly, still though we have a lot of technology, it is not possible for us to treat the cancer because cancer is usually identified at a very late stage. We don't have any early diagnosis. There are a lot of point of care devices. For example, during COVID, usually the pulse oximeter right? COVID handy we used to keep it because that is one of the important indicator that whether we have any suffocations, breathing difficulty. Before we feel, we wanted to test it. Especially COVID positive patients used to have it. Even we had it at our home. For the reason that, see, the person who had an idea that must be something very portable and that must be used for everybody. During that time, I was discussed with many of the clinicians. They said, "Emma, in the markers sepsis sepsis in the problem blood test do you have any specific point of care devices to tell immediately? Now sugar we have. We need everybody have it in at our home. Like we have BP machine, we have sugar machine, we can, okay, something is alarming, we can immediately go. So there are a lot of opportunities in healthcare. It may be a point of care devices, it may be a drug delivery, it may be any personalized. In fact, now we are all moving towards this personalized medicine. Why personalized medicine? Because cancer, I'll give you another example, a cancer, which is, everybody knew it. It has the capacity to metastasis, like it can spread from one place to other place and irrespective of any region. We really do not know which region that it is spreading. And most of the time, we were not able to realize if the person is suffering from cancer. For the reason that cancer, it is an abnormal cell growth at one particular organ. And the organ function affect organ. So the organ function affect we used to, all the doctors misunderstood that this is because of this factor, that factor. They never realized this is because of the cancer. So when they wanted to realize this as a cancer, they will be able to identify this. That is what we were not able to identify at the early stage. Because of that particular cancer, I lost my sister as well as my father. So we came to know only at the very last stage. We took them to hospital every time, but we never knew that, because doctor even knew that அவர் வந்து வேறு மாதிரிலாம் ட்ரீட்மெண்ட் பண்ணிகிட்டே இருந்தார். கடைசியில் தான் we came to know that there was a cancer. But that time it's helpless, it spread to everywhere. So and we also realized, like this medicines, ஒருத்தருக்கு கேட்கறது ஒருத்தருக்கு கேட்கல. When my sister, she died at the age of 23, she was a younger sister. So when she was diagnosed, first chemo was working fine, but when they gave the second chemo, instead of reducing this tumor growth, it accelerates the tumor spread. So that made, like the doctor said, avladama idu vandu avanukku against antagonist it is working, we can't do anything, we are helpless. So that time I realized, in fact it was not realized by me also, I have seen lot of patients, lot of family members also going through this, where few medicines are working for few people, not for everybody. இது வெறும் பேராசிட்டமால் மாதிரி தலை வலிச்சா போட்டுக்குங்கிறது இல்லை. இப்போ வர டிசீஸ் எல்லாம் எல்லாருக்கும் எல்லாம் கேட்கல. சில பேருக்கு கோவிடுக்கு மெடிசின்ஸ் கேட்டுது, சில பேருக்கு கேட்கவே இல்லை, அது பாட்டுக்கு ஸ்ப்ரெட் ஆகிட்டே இருக்குது. lot of differences in individual cases. So we are all moving towards personalized medicine. ஏன்னா இப்போ இருக்கிற நம்ம ஃபுட் ஹேபிட், என்விரான்மெண்டல் பொல்யூஷன், இதுக்கெல்லாம் ஒரே ஒரு மெடிசன் will not give any cure, so you have to personalize the treatment. So there are a lot of options in the personalized medicine. So you can ask your students to think about anything can be done for personalization. Personalization alone not, like will you be able to identify the disease 5 years early, 10 years early? If I came to know that the disease which are have diagnosed for my sister, ஒரு வருஷம் முன்னாடி தெரிஞ்சிருந்தா கூட we were able to save her, but we were not able to save her because we came to know at very last stage. So in fact a cardiac arrest, everywhere we see there are a lot of cardiac arrest. எல்லாரும் சிலதெல்லாம் வந்து treatable, சிலதெல்லாம் massive attack, அவ்வளவுதான். So do anybody knew that the cardiac arrest can be identified little early? நமக்கு தெரியாது. But like recently people have identified the AML technology to identify this kind of a risk of heart attack patients 5 years early. Because always prevention is better than cure. If something happened, treating is always difficult. There are a lot of individual variants are there. In the medicine kekalam kekama polam, but prevention is always better. Now people have identified a markers to identify the pre-diabetic condition. அப்பா உனக்கு இது இருக்குப்பா, நீ வந்து இனிமேலாம் ரொம்ப சாப்பிடாத, இப்போலேருந்தே ஃபுட்டாக குறைச்சிக்கோ, so that you may not be ended with the diabetes. That is even good, right? So there are a lot of opportunities in the diagnosis, early diagnosis, kind of a point of care devices, other technology that they can implement, AML use பண்றா. And there are a lot of technology like VR. You have a lot of opportunities to see this VR facility, what they have. VR வச்சு they can provide a lot of trainings for the healthcare. ஏன்னா ஒவ்வொரு ஆப்ரேஷன்ஸும் வேற வேறையா இருக்கு. ஸோ என்ன பண்ணுறாங்கன்னா ஆப்ரேஷன்ஸே ஃபுல்லாக ஷூட் பண்ணிடுது. ஸோ கிளினிஷியன்ஸ்க்கு வந்து ஸ்டூடெண்ட்ஸ்க்கு வந்து தே ஆர் டீச்சிங். ஒரு கேஸும் டிஃப்ரெண்ட் கேஸாக இருக்கும். நம்ம இங்கே ஆப்ரேஷன் ஒரு மாதிரி யோசிச்சுட்டு அங்கே போனதுக்கப்புறம் தே வில் சேஞ்ச் லாட் ஆஃப் திங்ஸ். ஒன்லி டாக்டர் கேம் டு நோ தட். There are a lot of opportunity in modeling. People are using surgical modeling. Surgical planning can be done by 3D printing. இங்கே வந்து மியாட்ல இருக்கிற cardiologist is associated with us. Heart pediatric cardiologist, so she don't want to try anything hard, so she wanted to first take the MRI, give it to them. They will take the printed heart, where exactly the issues. So in the printed heart avalda kudutha, they will plan the easiest way of doing the surgery to remove that X-ray is the component. So there are a lot of technology are available now for us to explore, and that can actually try to improve the quality of the patient life. So that way, that again we have a lot of point of care devices, personalized medicine. Still like digitalization. இப்போ பார்த்தா இந்த கோவிடுக்கு அப்புறம் நிறைய டெலிமெடிசன் கேம். இப்போ எல்லாம் ஃபோன்லேயே நம்ம ஆன்லைன்லேயே புக் பண்ணிக்கலாம், எது தேவை எந்த சர்வீஸ் வேணாலும் ஆட்டோ ஓலா புக் பண்ணுற மாதிரி we will book doctors now, and even doctors are ready to treat us through online mode. கோவிட் டயத்தில் வரவே வராத சொல்லி they used to come through video call and they will see all the things and they will suggest and you can do it. So, and now people are trying to create more portable devices. In fact, ஏன்னா portable devices இந்த ஹாஸ்பிட்டலுக்கே வர வேண்டாம், நேராக தூக்கி போய் வீட்டிலே வச்சு கூட they can do it. Lot of opportunities in medtech devices. Medtech area, there are a lot of opportunities. And as I said, there are a lot of time that is taking from the idea to the mature product, for the reason that you have to create a big timeline. You know, like there is an idea, you have to do R&D, you have to get ethical approval, lot of things. ஒரு 50,000 ட்ரக்லேருந்து கடைசியில் ஒரே ஒரு ட்ரக் தான் அப்ரூவ் ஆகி வரும். அந்த ட்ரக் சேஃப்னு சொல்லி 4 phase கிளினிக்கல் ட்ரையலும் முடிச்சிருப்பா. கடைசியில் பார்த்தா, as I said, my sister, when she used it was not working. Right? So like the way there are a lot of journey, if any idea or any way that to reduce this timeline, that is even a very good innovation. You know, like a lot of good medicines can be coming into the market at a faster rate for the useful of the human beings. And now இந்த கோவிட்லாம் வந்ததுக்கு அப்புறம் நிறைய ஜெனடிக்ஸ் வந்திருக்கு, because we have also genetic facility. So அதனால selfish I included that, because we are now all the ideas, most of the ideas that we are getting, you know, they wanted to identify the gene pattern, want to identify the sequence of what way that it is there, through which they are trying to identify the disease very late, early stage, and trying to provide more solutions. Lot of gene therapy, lot of gene specific நிறைய treatment options, நிறைய diagnosis are open up now. And immune cell functions, because எப்போதுமே there is always a faith, you know, like instead of taking something chemical agent, our natural immune system are very good, excellent in terms of treating the disease. Because especially for this cancer, all the chemicals that we are taking, they are all cytotoxic drugs. அதாவது overgrowth இருக்கிற cells kill பண்ணும். So what this will do, this will not only kill the cancer cells, because they don't have any smartness, they will even kill the normal cells also. அதான் நிறைய side effects, தலைமுடி கொட்டுறது, there are a lot of things that they are going through because of that. Whereas, do you have any options to stimulate the immune system to fight against that? Because that is something artificial, right? We have very excellent system. ஒரு சில பேருக்கு அது வந்து மெல்லமா ரொம்ப வேலை பார்க்காத போது தான் we are getting this. So now people are trying to identify different ways to improvise our immune system to fight against all diseases. So there are a lot of opportunities. You please, few are I listed, but there are quite more. When they wanted to explore it, lot of opportunities available in life science. And this is something 2022, what is the market size? You see always this very huge market, because nobody wanted to live with the disease, everybody wanted to have good comfort. So that always India, in fact, you know, like all not only the tourist part, especially medical tourism la vandu is a very excellent one. Namma kitta irukra alavukku infrastructure o namma kitta irukra alavukku cost effective treatment is not possible anywhere. There are more than you know, like a few million people are coming here for only treatment. So when you strengthen this, you know, like you have lot of opportunities. The market size is also very good. And the next important thing that I want to discuss, okay, these are all different opportunities, different market size. What our Indian government is doing for this, because this has a lot of potential. So we have actually a BIRAC, which is a Biotechnology Industrial Research Assistance Council, which is funded by Department of Biotechnology. It's a kind of a Section 8 not-for-profit organization. But this organization is entirely taking care of all kind of a biotechnology innovation across the country. And they are actually doing lot of support for any of the bio innovations. So one such thing is actually called as BioNest. BioNest, I said no, like a DST sponsor பண்றதெல்லாம் Technology Business Incubator சொல்லுவா. இந்த BIRAC supportedலாம் BioNest சொல்லுவாங்க. It's again doing the same. But these are all is mainly nurturing the entrepreneurship in the bio innovations to towards scaling the technology. So this is called as BioNest. The BioNest have a specific focus. So these are all the major focus. So you may have accessibility to the infrastructure. Life science now a lot of infrastructure is required, without which we cannot do it, and a lot of money involved in it. That is the another important issues. And there are a lot of legal and regulatory compliance are required. Marketing skills needs to be developed. So life science they are focusing. They are actually providing an incubation space to the startups and entrepreneurs. Even if somebody who have an idea, they can provide a space. There are 60 BioNest available across the country. 60 BioNest are available across the country for this particular focus. And they are trying to connect the industry and the academia, because that is very important. Of course, definitely origin of all innovations comes from the student community, but unless they have been connected to the industry, it is very hard. Because now I am in our incubation center, like we used to have one-on-one mentoring sessions. We will arrange some CEOs, CFOs for bio entrepreneurs, serial successful entrepreneurs, with the people who had an idea, one-on-one interactions. இப்படி போலாமா, இது ரைட்டா, இப்படி போகாத, இது தப்பு, you should do something like that. All kind of a full mentoring that they will be giving. Then accidentally, like I am also a technical person, though I am heading something as administration role, I would also love to sit with all mentoring sessions to understand what are all the key points that I have to take. Because this is also a BioNest, one among the 660. And this is also a Section 8 not-for-profit organization. It's a separate company, entity. So, one of the mentor who said, Nijamave, one of the guy who is working, he asked, then yes, it is important question. Don't look at only the literatures and the patents. There are a lot of industries who have actual problem. You should first find out the customer and talk to the customer. If something that I am working on healthcare aspects, until I realize what is the pain point that the healthcare person is going through, நான் பாட்டுக்கு பேப்பர்ல பார்த்துட்டு நான் பாட்டுக்கு ஒரு சொல்யூஷன் ப்ரொவைட் பண்ணா அது அவங்க கடைசி தேவைப்படுறதா it is not. So it is very important for us to interact with the industries right from the day one, the inception of the idea. So adu vandu also they are doing through us, kind of like we have lot of mentors. We will be arranging this mentor meetings and the other aspects. And similarly, we will give all other services, like most of the innovation needs to be protected, like there is a IP needs to be protected. So all our legal regulatory approvals, IP regulations, so these things also we are trying to bring it, and we will also support you in terms of developing the business model, and because most of them either they are from the business background or from the technical background. So we are trying to make them to build a good team, and we will be supporting the part which is not there, like the way that we are trying to foster these kind of innovations. They have a lot of funding opportunities, because as I said, okay, infrastructure they develop, but they have also funding opportunities. So there are ideas. So ideas, there are a lot of stages. There is a first idea to POC, which is called as early stage. From POC to the next workable prototype or a real product is a late stage development, and then that must be translated, because translation is something that I have done everything in the lab must be tested in the clinics if it is going to be a healthcare product. Like the way it's a very long journey for everything, BIRAC have different funding opportunities. In BIRAC website la ponale you have everything. Each have a different criteria. Each have there are a lot of opportunities for even students. Students irukku nariya, faculty ku nariya irukku options, entrepreneurs ku nariya irukku. So early stage ku similarly 10 lakhs, 50 lakhs varaiku early stage ku irukku. And late stage also we have lot of opportunities. These are all funding schemes only. And you have even schemes for translational research. And this is these are all grants. So far I am telling about our grants. There are some funding which is not exactly grant, equity funding மாதிரி. ஸோ நீ சக்ஸஸ் ஆனதுக்கு அப்புறமா நீ இப்போ உடனே ஒன்றும் கொடுக்க வேண்டாம். நல்ல ஐடியா வச்சு சக்ஸஸ் பண்ணி மெச்சூர்ட் ஆகி ரெவென்யூ ஜென்ரேட் பண்ண ஆரம்பிச்சதுக்கப்புறமா உன்னோட கம்பெனி ஷேர்லேருந்து எனக்கு இவ்வளோ கொடுக்கும். திஸ் இஸ் ஆல்சோ தேர். ஸோ ஏன்னா ரிஸ்க் தே ஆர் டேக்கிங் அண்ட் யூ வில் பி அலவுட். இப்போ நம்ம வரல நம்மளுக்குன்னா விட்டுடுவான், பட் வந்தது அப்படின்னாக்கா யூ ஹாவ் டு கிவ் சம் ஸ்மால் ஷேர் டு இட். Like the way that there are seed funding, lead funding, ACE funding, there are a lot of fundings available. And there are even a specific space for social innovation. In fact, which is very, very important, where they are providing more funds for the social innovations. நிறைய வந்து boot camps பண்றாங்க. நிறைய இப்போ they are doing lot of works to inculcate this kind of a knowledge. So, Bairakla ponale you can see all these kind of different programs. So ask your students to participate in all the programs. Even you can request your faculty members also to go through. If anything is very good, seems aligned with their intentions, they can also do that. So as I said, BIRAC is supporting 60 different incubators across the country in order to foster all biotechnology innovation. This is today morning I took. This is the latest report. See 60 incubation support, this many amount that they have given for bioness, this many area, this many incubators, and you can see that how many products that so far they commercialize. All made in India initiative. We don't go for anything for foreign now, people are, because they want to support in all innovations, so that we'll have manufacturing unit, we'll have production unit, we can get everything with the affordable cost. And there are a lot of IP generated, and it also gives a lot of like employment opportunities. So one among the BioNest is ABLEST, so which is Association for Bio-Inspired Leaders and Entrepreneurs, which is again a BioNest supported by BIRAC. It's a 3rd floor. Afternoon you have a visit there. So this where we also follow the focus of the BioNest BIRAC, what exactly that they are doing. We are also supporting all kind of bio-innovations by providing infrastructure, mentoring and networking, connecting you to the all industries, training problems, trainings. So all way that we are also supporting in aligning with the initiatives of the vision and mission of the Government of India. And we have again a lot of infrastructure. So you can see the laboratory, because you know that all life science demands some wet lab. Wet lab இல்லாம ஒண்ணுமே பண்ண முடியாது. So we have wet lab, individual work benches that was kept with all essential accessories like ஒரு pipetting இருக்கட்டும், ஒரு stirrer இருக்கட்டும், ஒரு vortexer இருக்கட்டும், ஒரு hot plate இருக்கட்டும், அந்த மாதிரி ஒவ்வொரு பெஞ்சுக்கும் we used to provide. And addition that they can have access to many common facilities. And we have very excellent BSL-3 facility. Hope you all have known what is BSL-3. Biosafety level 3. COVID la experiment பண்ணனும்னா you have to go for only all infections related பண்ணி ஏதாவது ஐடென்டிஃபை பண்ணனும்னா BSL-3 facility இருந்தா தான் பண்ண முடியும். Because that facility give you utmost safety not only to the individual who is working in the lab, it is also providing the complete safety in and around the lab throughout the environment. We had a 1 crore BSL-3 facility at our center, which is dedicated for only doing this kind of infectious disease researches. So we have all negative pressure, epoxy flooring, உள்ளுக்குள்ளேயே எல்லா equipment இருக்கும், double door autoclave எல்லாமே இருக்கும். We have in place all the rules and regulations, guidelines, all authorized things that we have. You have to follow all the rules and you have to get the committee approval to enter inside. So also have to get the training, without which you may not be allowed inside, and we used to give only 2 for the individuals who want to work inside. ஒரு டைம்ல 2 பேர் தான் உள்ள ஒர்க் பண்ண முடியும், not more than that. It was integrated with the camera and the other all safety aspects. Will not allow any of the molecules to get outside of the lab. At the same time, it will not be going to affect any of the individuals who is working inside the lab. So that way that it was completely developed with the BSL 3 compliance, and we have even applied for certification now, because last April it has come that you have to get the approval if something is the new facility, without which we are not allowed to start the facility as such. So we have built everything and we have applied for certification, awaiting for the approval. So once this facility was approved by the Government of India of seeing all the compliances in place, then it is possible for anybody to use this facility. So please keep this in mind. And we also have a very excellent cell culture facilities, because that is even again required for doing all laboratory works. So we have 3 different cell culture facility. With individually we have all the infrastructures, and we have molecular biology facility even. This molecular biology facility now, right from the extraction of genetic material to the sequencing facility. We have even next generation sequencer. So any clinical, any sample, we can identify the sequence within 4 to 6 hours. So that much of the higher rapid sequencer even we have. And this is a next generation sequencing facility. This equipment alone is cost more than $1 crore. So we have other facilities like walk-in cold room, we have water purification system, we have an imaging facility, and we even have a small animal facility here, because most of the healthcare related life science based products demand some preclinical studies. So we have small animal imaging facility at Shastra, where we actually kept our individually ventilated cages, through which we may be able to keep the animals as per desirable conditions individually in every cages. So that would be possible. We have this also. And this is a small video which I would like to play. It's only 2 minutes to explain what exactly the facility that we have. So we usually nurture all kind of innovations. So right from the basic technology research to the technology demonstration stage. So we believe it is around 2 years it will take, since it is a life science or a healthcare, and even sometimes it may require more than that too. So we are incubating at any stage, not only the idea stage, even if something at the research to proof feasibility stage or even technology development stage. Each and every stage we'll be able to support them, and each depending upon the stage that the people are coming, like we have to approach them differently. Like we cannot, let's say for example, if the people who are only the idea, then they definitely require a lot of assistance in terms of infrastructure and the other things. Whereas somebody who have already proved the feasibility demands the different things, where we need to concentrate more on the mentoring, business plan development, and the connections to the other stakeholders, customers identification, those things. Like the way that depending upon the stage what exactly they are, we used to provide the personalization of our commitment towards individual incubators, I can say even innovators, and through which our basic goal is to launch either in terms of a specific product, or we have to create more enterprises through this particular facility, because in all cases, like there are a lot of job opportunities that we can see. Because those who are at our facility, once they have started incorporating the company after a few days, few months, like they started asking, ma'am, you have a very good student community here. Why don't you give an option for us to do an internships? So now they are trying to like post a lot of job descriptions. That is also we are doing it. And we'll be planning, we have separate website also, please go through that. So we'll be planning to keep one more thing, all job vacancies and the other things. So whoever is, we have as a company here, and there are a lot of opportunities for the students to apply. So there are a lot of job opportunities is also possible. And anybody wanted to have specific knowledge creation or any training would also be possible. So currently we have 21 different ideas that we supported. So 6 are in the technology demonstration stage. So thank you. If you have any questions, please.